Good afternoon. My name is Adrian Dix. I'm BC's Minister of Health. To my left today is Dr. Bonnie Henry, BC's Provincial Health Officer. This is our COVID-19 briefing for Monday, March the 8th. Honored to be here on the territory of the Lekwungen-speaking people of the Songhees and the Esquimalt First Nations tomorrow, Tuesday at 3 o'clock. We're providing an update with COVID-19 case numbers, a written update. Similarly, on Wednesday, we'll be providing a written update at 3 o'clock, and then on Thursday, Dr. Henry and I will be providing an in-person briefing, and Dr. Henry will be updating some of the modeling and other updates on the state of the pandemic in British Columbia 1 year after a pandemic was declared by the World Health Organization. And with that, it's my honor to introduce Dr. Bonnie Henry.
Thank you and good afternoon. So today we're reporting on the three periods over the past weekend. From Friday to Saturday, we had 545 new cases of COVID-19 diagnosed in British Columbia. From Saturday to Sunday, an additional 532 new cases. And in the last 24 hours, 385 new cases diagnosed in British Columbia, for a total of 1,462 new cases in the past 3 days, 19 of whom were epidemiologically linked cases. So that brings our total to 84,569 people in British Columbia who've been diagnosed with COVID-19. Of the new cases, 407 were people in the Vancouver Coastal Health Region, 802 are people in the Fraser Health Region, 72 people in Vancouver Island Health, 79 people live in the Interior Health Region, and 102 were in the Northern Health Region. We now have 4,854 active cases, and 240 people are in hospital, 66 of whom are in critical care or ICU. We now have over 8,723 people under active public health monitoring across the province, and 78,237 people who have passed their infectious period and recovered. Sadly, over the weekend, we had 11 people who died from COVID-19, bringing the total number of people who've died in British Columbia to 1,391 since the pandemic started. And our condolences, of course, go to the families and the care providers in our communities who've lost loved ones again this weekend. We have one new health outbreak in a long-term care home in the Interior Health in the Cottonwoods Care Centre, and this is a home where all of the residents and staff had been offered immunization and a very high uptake of immunization, and some of the cases are in people who had received 2 doses of vaccine. And this serves to remind us that while we are very confident that vaccine is very effective and prevents particularly severe illness and death, it doesn't necessarily mean that all transmission will be stopped. And we need to be mindful right now, when we still have high levels of transmission in our communities, how important it is to continue those precautions, particularly with older people and in care homes. On a positive note, the long-term care outbreak at Royal City Manor has been finally declared over, and that is a huge relief, I know, to the families who have people and to the people who are living in the Royal City Manor. As well, the SFU Childcare Centre outbreak has been declared over. So that leaves us with 10 active outbreaks in long-term care, assisted living or independent living, and 8 in acute care units. And right now we have about 194 residents and 112 staff in long-term care involved. We also talk about updating on the variants of concern. There have been, over the past few days, 144 new COVID-19 cases that have been determined to be cases that have a variant of concern. So this brings a total of 394 people who've had the whole genome sequencing to determine that they carry one of these variants. 87 of those people are now are active cases, and the remaining are people who are no longer in their infectious period or have recovered. The majority continue to be the B117 variant that's associated with the UK. 363 cases are that, and 31 are the B351 or 1351 that's been associated with South Africa. So still a small proportion. The majority of these confirmed cases are in the Fraser Health region, where we are continuing to see the majority of transmission. So 303 are in the Fraser Health region, 74 in Vancouver Coastal Health, and 6 in both Island Health and Interior Health. The trend continues in that about a quarter of these cases we do not know exactly how they were transmitted, which tells us that these variants are some of the viruses that are being transmitted in our communities now, particularly in the Lower Mainland. On a more positive note, on our vaccine update, we are continuing with the increased shipments of vaccine that we received last week and even more this week. Over 333,327 doses of COVID vaccine have been administered in BC. The majority of those now are, of course, our first doses, and we remain at about 86,925 second doses. And today, vaccine appointment bookings open for people over age 90 and for Indigenous peoples over age 65. We know that the appointments are available in multiple locations around the province starting next week, and those clinic places have been posted in all of our health authorities. And we know there has been extremely high call volumes today, and teams are working to respond as quickly as possible. While I'm grateful to see the enthusiasm that we have, we ask everyone who is outside of the age groups for this week to please be patient and wait your turn. We know that there will be time for everybody, and everybody will get their vaccine as soon as we can arrange the appointments. Calling this week, if you're outside of these first age group, will not speed up your turn, but it may cause more delays for people trying to get appointments for their loved ones or for themselves who are in this first phase. We can all do our part by waiting our turn and not calling multiple times. In terms of vaccine as well, we know we have increased shipments of Pfizer. That was announced on Friday. We'll be receiving more of the Pfizer-BioNTech vaccine in Canada and here in BC in this month of March, and that is very good news. And we are expecting our shipment of the AstraZeneca Serum Institute of India vaccine to arrive in BC in the next day or two. And as you know, we've talked about the importance of using these increased volumes right now to address where we are seeing significant outbreaks and community transmission. And one of those areas that in Northern Health that will be addressed in the coming days is the ongoing transmission and increasing cases in Prince Rupert. And in addition, the health authorities are working at identifying some of the large workplaces where we are seeing ongoing transmission and transmission that affects people in our communities, particularly on the Lower Mainland, and we'll be addressing those in the coming days. Our goal throughout our 1 year now of this pandemic has always been to have as much as is safe open, while also protecting those who are highest risk. And now with our vaccine programs taking off, that protection is so important and allows us to think ahead to where we will be in the next phases through the next few weeks and months until we get to that point where we can start moving into our post-pandemic world. It is likely we are still going to have to deal with the virus that causes COVID-19, but we will be in a much different place by the time we head to the summer. As part of what we have been doing all along, we regularly review the orders, the PHO orders that we have out, to make sure that restrictions that are in place to determine whether we can safely ease these restrictions. And this is something we've been paying a lot of attention to in the last few weeks. As our immunization program ramps up and our days are getting warmer once again, In the weeks ahead, we can start to look at this modified return of some of the activities that we have been on pause for the last months of winter. We're not going to rush to get things open, but we will take a thoughtful, careful, and phased approach over the next few weeks. I like to think of it as slowly turning up the dial again rather than flicking a switch, because we know that we're not yet in a place where we can go back to our pre-pandemic gatherings. We know as well, we've learned as we go with this pandemic, and that is the joy of science and the challenge with science, that as we're learning, we know that some things can be more dangerous, more risky in some situations than other. But we also know, and it continues to be true, that outside is better than inside. Bigger spaces are better than smaller spaces, and our layers of protection will still be needed and still work, even with the increasing numbers of cases caused by more infectious variants. And as we head into the spring and summer, we know that the transmissibility starts to fade as well. These principles will be guiding our decisions in the coming weeks in terms of what we are able to ease and when, and what we are looking at as we head into March break or spring break at the end of this week and into next week. Is seeing the return of things like gatherings outside where it's safer, activities outside that we can do in groups with precautions in place, small groups that we can do for games and summer camps or spring camps, and safe small groups with masks and safety precautions in place. As well, we'll be looking at how we can travel and explore during March break as a family or a small group together with our household, exploring our own region and making sure that if we are going to different parts of overnight within our region or within the province, that we do make sure that we're not going to places that are not yet ready to receive visitors. The risk is different in different communities in this province, and we need to be mindful of that even as we increase our outdoor activities. As well, in the coming weeks, we hope to see the return of sports and religious ceremonies. Throughout the pandemic, we've been in regular dialogue with faith leaders, and I am so grateful for that opportunity to speak with them on a regular basis and to understand the concerns and the needs. And faith leaders have been regularly convening under the guidance of Dr. Robert Dome through the SFU Centre for Dialogue. As part of these efforts, we are working together with faith leaders to develop an approach to enable the gradual return of in-person religious services. Again, a phased approach in the coming weeks. We know there are many important dates coming up in many faiths, and we are working on how to best safely enable these important and critical celebrations in our religious life to take place. So the focus will be in the next few weeks to meet both the specific needs of different faiths around these celebrations and to ensure that public health measures and safety precautions remain in place. There is much that we can look forward to in the coming months as we look ahead. And I want to take a moment to recognize what has happened over this past year and how everything that we know has been changed in so many ways. This past year has challenged us all, and we've learned that we are stronger and far more resilient by supporting and encouraging each other along the way. Today, as we celebrate International Women's Day, I also want to recognize the many, many women who have been instrumental in our COVID-19 response here in BC and across the country and the world. Particularly my public health colleagues here in British Columbia and across the country, but also the mothers, the sisters, the aunties and daughters who are making a difference every day at work, at home, in their communities across this province. We know this pandemic has been hard on so many, but let's keep building this momentum that we have gained and continue to do our part to keep each other safe and put this pandemic behind us. And I am in awe of all that people are doing and grateful for the work that we're seeing. And let's continue on our path together. And as I heard the other day from a knowledge keeper on the BC Association for First Nations call we had, Robert Joseph, a very wise man, said, "We will celebrate our lives again, dream our dreams again, and watch our children regain their hope." And that's what we can look forward to in the coming months. But let's also continue to be kind to each other, to be calm, and to stay safe.
Thank you very much, Dr. Henry, and on behalf of the Premier and the government, I want to pass on my condolences to the 11, to the families, the friends, the caregivers of the 11 people who passed away this weekend as a result of COVID-19 across BC. 3 from Friday to Saturday, 4 from Saturday to Sunday, 4 again from Sunday to Monday. It is an extraordinarily difficult time. I had the opportunity in the last few days to talk to a number of people who dealt with the fact that their celebrations of lives or funerals or memorial services only had a handful of people at them and what that meant to them. And we hear that. And so it means that all of us have to do everything we can within the limits right now of COVID-19 guidance and protocols and rules to support those who've lost loved ones in this pandemic, including and especially the 11 who passed away this weekend. I wanted to say that 333,327 doses administered, 246,402 first doses, 86,925 second doses. You'll note that the number of second doses in the past week is slightly less than 400, and the rest, basically the other 50,000 in the past week, have been first doses. And this is part, of course, of the changes in the Phase 2 vaccination plan that were put in place by Dr. Henry and her teams in public health. I wanted to note that yesterday we listed the locations for Phase 2 immunizations across BC. There'll be 180 different clinics in Phase 2 across British Columbia. A note in Phase 1, because it was done at all long-term care homes, at assisted living homes, of course, at other sites we had 1,390 clinics in Phase 1, and we're going to, of course, add some very large clinics as we reach out in Phases 3 and 4. With respect to today, I want to say a couple of things. First of all, to note that we're now booking seniors 90 and above, that's born in 1931 or before, at the moment, and Indigenous people 65 years and above at present. I just want to put that in context. In terms of the 90 and above category, there are approximately 47,000 people across British Columbia who are 90 and above, a number that has been growing considerably in recent years. That to date, 19,733 of those have received their first doses and 8,849 their second doses. In other words, from the 47,000, we can take away approximately 20,000 people, leaving us with 27,000 people to book this week. On the Indigenous elders, 65 and above, and there are other Indigenous elders, but those that are 65 and above, that number is approximately 35,000, and approximately 7,000 to 8,000 of that group has already been immunized. So what we have today and what we opened today was for a relatively small group of people, and of course we've got an extraordinary amount of public interest. In the first hours, in the first morning, 1.7 million calls. This has been reported widely. I'd like to say a couple things about that. First, it's really important in order to allow those over 90 to get their appointments that we only call when our age group becomes open for calling and for booking appointments. That's important because it allows our fellow citizens, particularly our elders, to get their appointments booked. But secondly, as the numbers tell you, every week we're going to have more and more people eligible to call in. There are more people, of course, 85 to 89, and then 80 to 84, and so on. So we need, that means that the demands on our system are not going to get less, they're going to grow every week. And so it's really important that people follow our advice and the need to only call in when they can book an appointment. It's also important that we do better. And I know that people have called in and have waited a long time today, and I want to say to all of them that I understand, and our provider has to understand that we have to do, our call center provider has to understand that we have to do better in responding as well. And we will need to, because the demand isn't going to get less, it's going to grow until our general immunization is full on in phase 3 starting on April 12th. So I wanted to express my appreciation to everyone working on this today, those booking appointments, and who've been out booking appointments, and to everyone who's shown patience on this first day of booking appointments in BC. And I want to let them know that we know that we will do better, and that is my expectation in coming days. In closing, I just want to say that we're still in our BC pandemic fight, that our case numbers are persistently high, as they were just under 1,500 over the weekend, with some indicators on the rise, and some, fortunately, stable, such as hospitalization over the last few days. I think in our heads, in our hearts, we know that this is not and cannot be our new normal. Our excitement about the future doesn't excuse us from our daily duty to stop the spread. This is an important moment. This month of March is important, and it's an important time to follow public health measures. A relief at the approval of vaccines, the opening of our call centers, and the listing of immunization clinics across BC does not relieve us of our continuing obligation to use our skills and adhere to the guidance and orders that keep us healthy. Our hopes for post-pandemic freedom do not preclude our immediate and ongoing need to act to save lives. This is no time to drift from what we know stops the spread, keeps us healthy, and saves lives. A better future is the truest test of our commitment today. So staying 100% all in on our fight right now is the safest and fastest path to our realizing the full potential of future days. I want to say finally to all of the women working in healthcare, we are very fortunate in BC that the presidents and CEOs of our regional health authorities are all women. We have an extraordinary team. The majority of them are women in public health as well, who do an amazing job, and our healthcare workers across BC include really in the tens of thousands of extraordinarily dedicated women. And in this pandemic, as we go on to a year of it, I want to pay tribute to them today on this International Women's Day, for us to think in our mind's eye of the work they've done at the bedside, in the lab, leading in this pandemic. I am inspired by their commitment and their leadership and their effort in this time. Thank you. Thank you. Thank you. Aujourd'hui, nous faisons le point sur le nombre de nouveaux cas pour 3 périodes de référence de 24 heures chacune, soit celle du 5 et 6 mars, celle du 6 et 7 mars et celle du 7 jusqu'au 8 mars en mi-journée. Il y a eu 11 nouveaux décès liés au COVID-19 durant ces périodes de référence. Pour la première période de référence, qui s'étend jusqu'au 6 mars, nous avons eu 545 nouveaux cas. Pour la deuxième période de référence, qui s'étend jusqu'au 7 mars, nous avons eu 532 nouveaux cas. Au cours des dernières 24 heures, 385 nouveaux cas se sont ajoutés. Je veux donner mes condoléances, offrons mes condoléances aux familles et aux amis des gens des personnes décédées du COVID-19 en Colombie-Britannique. 1391 jusqu'aujourd'hui. Et à tous ceux qui ont perdu des êtres chers au cours de cette pandémie. Parmi l'ensemble des cas confirmés de COVID-19, 240 personnes sont actuellement hospitalisées, dont 66 en soins intensifs. Merci beaucoup. Thank you very much. We're happy to take your questions.
Thank you, Minister. As a reminder to everybody on the phone, please press *1 to enter the queue. You are limited to 1 question and 1 follow-up. I would also ask that you please remove yourselves from mute. You're not audible till I call your name. First question today is from Katie DeRosa, Vancouver Sun.
Thank you, Minister, and I definitely appreciate you saying that the government is going to fix sort of some of the backlogs in the system. Can you say specifically how you're going to do that? Will you be hiring more staff, this week? How soon could that happen?
some of the issues are technical and caused by the sheer massive volume of calls. And so I think part of it is just speaking to people, and people will start to learn and understand the system. I think people in BC have responded every time we've asked them to contribute, and my expectation is that'll happen. And obviously, as call volumes decrease over the next number of days, that will increase the efficiency of everyone involved in the system. But as well as it's our expectation as we go through the coming weeks that we'll be adding resources weekend to week, and that will happen this week, and that will happen in coming weeks, because we simply have to respond quickly to people. This act of booking an appointment is for, I think, all of our people, particularly people over 90, people over 65 and their families. It's a solemn act. And so we've made real progress. Those groups, as I say, there's 47,000 approximately people over 90 in BC. Almost 20,000 have already been vaccinated, and a significant number, of course, and many thousands received their appointments today. But I think as we go along, we're simply going to have to respond better, because every time we go through a new category of person, there's going to be more people in that category. And once we get to the point where the online tool is ready for April 12th, when we go really broad in general immunization, that will help, of course, but we want to make sure we meet the test in the meantime.
Katie, do you have a follow-up?
Yes, please. I mean, could the online system be added sooner? Because there are some seniors who are saying, you know, they're happy to learn the online system, or that they could do it, or that their family members who are booking on their behalf could navigate the online system like what's happening in the Fraser Health. So could the online option be added quicker to these the first groups?
Yeah, I think we need to be aware that there is quite a large project in terms of developing a seamless online and phone system for April. It was not possible. Obviously, we wanted it to be ready for weeks ago, but it does take time to get those things together. And Fraser Health was the only health authority that had that type of an online booking system that was robust enough at this point. But I will say that, you know, the call center provider that has been charged with working on this needs to step up as well, as well as the health authorities, and it will get better. But the challenge we have is that we don't have a system that allowed us to do this seamlessly that was pre-built, and it's unfortunately something that we're seeing across the country. And hopefully this will be a legacy system that will allow us to do a lot more in the future.
And Fraser Health has a system in place that a significant number of people were able to book appointments on today, and that was something they built out as part of their testing process last summer. And the overall system, the platform, will be ready for the launch of Phase 3 on April the 12th. And in the meantime, our expectation is that our call center system will respond well to people, and that means calling only when you're able to book an appointment, in this case seniors 90 and above, and Indigenous people 65 and above on the one hand, but on the other hand, absolutely, we need to respond more quickly and better to people's calls, and that's already happening through the day, but it's our expectation this week that it'll get better every single day.
Next question is from Richard Sussman, Global News.
I'd like to change gears for a moment here. Dr. Henry, you mentioned International Women's Day and the important role that women are playing in our pandemic. And I'd like to ask a question on behalf of a colleague here about, why you believe so many women are a key part to guiding us through the pandemic. And do you see this trend as one in the right direction where gender equality in sciences is concerned?
Absolutely. I hope that seeing strong women leaders that we have seen around the world and here in Canada is an inspiration to young women and girls everywhere, that they see themselves in science, technology, engineering, math, and arts, and all of the other important parts of our learning and our environment. But I think this has been, I am in awe of my colleagues here in BC and across the country. their ability to talk to people about the science, about the epidemiology, about all of these things that we're learning about along the way. And the fact that, this year has been full of that, I hope is an inspiration. I will also say, though, that we know that this pandemic has not affected people equally, and we know that it has differentially negatively impacted women in many different job areas, that the women are more likely to have lost income, to be at home, to taking over the roles of caregiver and teacher, and it's been very, very challenging for women. So I think we need to not lose sight that as we get through this pandemic and we start to look at our processes again, that we are able to address some of the inequities that the pandemic has shown us, not only for women, but for racialized women. And we see that in healthcare, we see that across the board in people who are more negatively affected than others.
Richard, do you have a follow-up?
Back to the overall picture of the pandemic, you mentioned that we're going to start easing things in a few weeks' time, and we're hearing light at the end of the tunnel on the vaccine. Are you worried that sort of looking forward with positivity is actually having the reverse effect, and people are easing their own restrictions sooner because of that, and that's leading to this recent spike in cases we've seen?
I think we're all at that point where we're frustrated. We want things to be better, and the reality is they are going to get better. And I think at this point, having that vision and that hope of where we're going is something that we all need. And right now, the focus that we need to be is to focus on those things that we can now do safely. And being outside is another important one. We talked about trying to get outdoors every day, but recognizing that we're going into March break or school break, and it's the opportunity now to do that safely with young people, to have those opportunities to get out of the house, to go and do things safely outside with some of your close friends and cohort, but keeping it small. So the basic principles right now that we need to phase in are, yes, let's go outside, let's meet up and go for a walk. Let's meet up with our close friends and sit outside at an appropriate distance from each other, but still being very careful about those people who are still at risk of having severe illness from this, because we know that hasn't gone away yet, even as more vaccine is coming. So we have to be able to look ahead and to plan for how we're going to get to that next phase.
Next question is from Shannon Patterson, CTV.
Oh, hi, guys. We'll start with Minister Dix. At your 10 a.m. press conference, you said you'd have information on the number of appointments that have been booked by this press conference, by 3 o'clock. So how many of those 80,000 or so seniors that are eligible starting now have booked their appointments? And also, can you give us a more up-to-date number of calls to the lines? You said by 10 a.m. it was 1.7 million. Can you give us a sense of where we are now?
So as I noted, of the roughly 80,000 that are eligible to get appointments in these categories, roughly in the neighborhood of 26,000 have already received them, so that reduces the number. It's my understanding that about 10,000 appointments have been booked to date. A significant number of those through Fraser Health's online site, as you'll know, and so that's about the number. And on the latter number, what we'll try and do is include that in the statement shortly, because as you know, it was building up through the day. But I think the 1.7 million in the morning gives you a sense of the sheer volume of calls we are facing. So those numbers will be available, and we'll continue to have updates through the week.
Follow-up, Shannon?
Yeah, you probably saw, Dr. Henry, that the U.S. CDC has released long-awaited guidelines on how fully vaccinated people can safely visit others. They're saying that 2 vaccinated people can be indoors without masks. They're saying that they could even, in some circumstances, meet with unvaccinated people. So what do you think of their recommendations, and when can we expect guidance here? People really want to know when they can visit with, say, their parents and grandparents once the seniors have gotten their first dose of vaccine.
Yes, and I think that is, I did see what the U.S. CDC has put out. I think those are fairly reasonable guidelines, and I think ours will be very similar when we're, however, we don't need to wait until everybody has their second dose. And we do need to continue to pay attention to people who are more at risk of having severe illness from this virus or of ending up in hospital. And right now, we're not at that point where we have enough of the people who are at risk immunized that we can have overall guidance, but we're taking those things into account in terms of visitation to long-term care. And it does mean that when you're out in public, when you're out in communal settings like that, where there are people who are still at risk, even if they have been immunized, we need to continue to wear masks to ensure that we're using all the proper precautions so that we're not putting people at risk when there's still so much transmission in our community right now. But I think that's a very good example of what we can look forward to as more people are protected, particularly more of our seniors and elders in the coming months.
Next question is from Jane Side, North Shore News.
Hi, Dr. Henry. I guess my question is sort of related. I'm wondering about specifically the example you mentioned about a long-term care facility where everyone had received their vaccines, but there was still an outbreak. I'm wondering about that case. People have also been questioning when a lot of the Lower Mainland long-term care homes, they've had their vaccine in January, it's 2 months ago, and they're wondering why would you not start opening up to visitors, because most of these people are not going to live for years and years and years, and they're wondering, is there ever going to be a time when sort of a normal-like visit can happen at these long-term care homes, given that the people who can be vaccinated have been vaccinated?
And the short answer is yes, it's coming, but it's coming in a measured way as in the next little while as the rates in our community go down, hopefully, and as more people are protected. So we still know that people who visit people in long-term care are they themselves sometimes at risk, so we want to make sure we have as many people as possible. But yes, you can continue to have transmission even when people are fully vaccinated, so several weeks after 2 doses in this case. However, we are now watching very carefully, because what we've seen in other parts of the country and in the U.S. is that the illness is milder and doesn't transmit as much, so we don't expect and hope we won't see those rapidly explosive outbreaks that we've seen in long-term care homes. So those are the types of things that we'll be watching really carefully. But right now, because there is still so much transmission, we're not at the point where we can just open up care homes, because that still puts people at risk. But we are working on those guidelines, and I have committed by the end of this month we will have new guidance, even before that if we can, that will allow for increased visits with our loved ones in long-term care.
Follow-up, Jane?
Yes, my follow-up is about a different group, which so far hasn't really been addressed in the vaccine plan, which is children and teens. As we know, I think one of the vaccines is approved for people down to 16, and there's trials in place for 12 and over, I think, with one of them, but there's still a significant portion of the population in BC that falls into that category. So where does that leave families, children, teens, say after July this summer, when the adults have been vaccinated but the children and teens haven't, especially given that the kids have had a lot of their activities restricted, they've had their sports and social lives restricted. When do they get to have some kind of normal life, and how will families navigate that when adults have been vaccinated and children haven't been?
Yeah, all very good questions, and I don't have all the answers yet because we're still working things out and trying to understand them. But we know that for the most part, young people don't have a severe illness, so that's good news. That means that we have more leeway, even if they are transmitting, to be able to have more activities sooner and not have as great a risk. I'm not saying no risk. We know that some children do have severe disease. We know that some of them end up with long-term complications. So what we need to do, and the aim of the program, is to reduce the amount of transmission in our communities so that we can have all of our activities safely come back to normal-ish. And I say that because it's likely we're going to be dealing with this virus for many, many more months, even years. But if we can prevent people from getting severely ill, prevent hospitalizations and deaths, that is how we can manage the pandemic piece and get back into activities. But as you say, the Moderna vaccine is licensed or approved for use right now down to age 16. We have included teenagers with severe, with some medical conditions in the vaccine program under the group of people who are clinically extremely vulnerable, and more information will be coming out about that. There's a number of people in that group. And there are all ongoing studies. As we've said all along, we are learning a lot as we go, and that includes about vaccines and about how well they work. And when the vaccines are started, the focus was to develop a vaccine that would work in those who are most at risk. So for many other diseases that affect children more so than adults, the vaccine development is focused on preventing illness in children. And I was struck just last week, I happened to be in the legislative library, and it was open to a page from April of 1955 when the polio vaccine was approved for use for the first time in this country. And the headline was "Vaccine for All by the End of the Year." And the analogies with what we're going through right now just really struck me, because it was the same information about how well it protected children who were at risk and how it prevented them from ending up in hospital or dying from polio. And I know my mother and her generation, this was just an amazing change for them, because they could get through the summer without losing their friends to polio. I think, we need to think about this in the same way. These vaccines are new. We're finding out that they work, and they work in the people who are most affected by COVID-19, and that's our seniors and elders. And we're now moving to test it in younger people, and it's likely to be the end of the year before we'll have more data around the vaccination in younger people. But in the meantime, if we can get enough of our adult population and those high-risk settings under control, so making sure that we protect the adults in the school system and that we have some measures in place to reduce transmission in schools. But it will look different, and we are looking at, I think, I can say with some confidence that school for K-12 will look much more normal by next September, because the risks in our community will be decreased by the immunization program. And same for universities. I think we need to start planning that full back into campus and campus life and those important connections and social and emotional growth that we see in those situations will be back to much more normal. But we will still be doing some things. There will be still some times during the respiratory season where we'll need to wear masks in certain situations, reduce our crowding, particularly if we're somebody who's at risk. And we've seen these measures work for influenza, and I suspect we'll be adding COVID in some way or the other to the types of settings that we'll need to pay attention to. But I fully expect we'll get to a post-pandemic way of looking at that by this summer. And of course, we'll never have to stop washing our hands.
Marcella Bernardo, News 1130.
Hi, Dr. Henry and Minister Dix. I'm not sure which one of you can answer this, because it's something that's been coming up this morning with call centers being overloaded and talk about mass vaccinations. But how are you, or what checks and balances are being taken to stop people from cheating the system and running the risk of alienating people who don't have ID, but yet again keeping casino bosses and their wives from lining up to try to get immunized when they're not eligible?
I think there's some very basic things. I think we know that the vast majority of people understand that we need to do it in a phased approach. And again, to reassure everybody who's in BC, it doesn't mean you have to have a PHN, it doesn't mean you have to live here permanently. Everybody in BC will get their vaccine in the coming weeks.
I think, Marcella, generally speaking, people calling into our call centers do have a personal health number, and if their age is, if they're born, not born in 1931 or before, this week they won't be able to book an appointment. Similarly with the age limit for Indigenous people. So I think we have ways in a general sense to control that, and we will. That's why we have an appointment booking system. And I think I just want to remind everybody this week who is eligible this week to book appointments that they have a number of days to do it. You won't lose a place in line. There's lots of vaccine to address the group of people over 90 and Indigenous over 65. We will be ready for you. There's lots of appointments, and if you didn't book an appointment today, you can book one tomorrow. But the issue of people gaming the system, when we hear that or we hear people not following public health orders, I think for all of those people who are following it is irritating. And I'm not saying there won't be any of those cases, but I do believe they'll be relatively few and far between, mainly because we have a community in BC that's been incredibly committed to working together to deal with the pandemic on the one hand, and on the other hand, we have some controls to make sure that doesn't happen.
Follow-up, Marcella?
I do, and it's regarding faith services and church leaders hoping that they might be able to get back to somewhat of a normal existence in time for Easter and Passover and other religious ceremonies happening in the springtime. I heard you earlier suggest that this is possible. So could we see people being able to sit in pews at their church for Easter?
That is our goal, and we are working closely with our community of faith leaders, and I want to express my gratitude to Dr. Dom, who's been leading a really great understanding with people, and it's really helped us see the issues that people are dealing with, and the tenets of certain different faiths and different ceremonies, and how important they're not all the same. And I've heard that that for some people a funeral involves X number of people doing certain important parts of the ceremony, and so we are looking at how we can make sure all of the important celebrations that are coming up, Easter being one of them, Passover as you mentioned, and we know that Ramadan and Vaisakhi are coming up, and how do we make sure that people can celebrate those safely? And yes, that's our plan. My only qualifier is, we're still in the middle of this pandemic. We're not. We're in the last miles of this marathon, yes, but we still have a lot of transmission in our communities. So we want to make sure it's a careful and thoughtful, phased approach. So it may not be what Easter celebrations have been in the past, but they will be celebrations, and unless things go off the rails, we are planning for them to be in person.
We have time for one more question this afternoon. For everyone listening, Dr. Henry and Minister Dix will release a statement this afternoon with the latest information on cases, hospitalizations, and outbreaks, which you can find at news.gov.bc.ca. For updated province-wide restrictions, visit gov.bc.ca/COVID restrictions. And for information about the province's orders and pandemic supports, visit gov.bc.ca/COVID-19. Last question today is from Tanya Fletcher, CBC.
The rollout plan last week suggested people could book today for appointments starting next week on the 15th, but we're hearing about seniors 90 plus getting appointments, calling for appointments today and getting appointments today. So did something change to put the rollout ahead of schedule?
It's more availability. We've been working really hard to get the clinics set up. Right now, it varies around the province about who's going into the clinics. So some of them now are for healthcare workers, and so if there's places available, those spaces are being filled. But they'll be at full strength by next week and focused on the priority populations and our seniors and elders.
And just as well, you know that there's roughly 24,000 people in the category of long-term home support and community health supports that we're providing, in many cases, appointments in their own homes or in other circumstances. So that's happening this week. The first part of our over 80 plan and our vulnerable elders plan involved obviously long-term care and assisted living, and almost on all of independent living and seniors residences now, lots of other congregate circumstances, and lots of seniors have appointments this week, for example, who receive long-term home support in other circumstances. So there's lots of people who will be receiving the vaccine this week in these categories. And so in the group over 90, the number of people that need to book is less than the 47,000 entirely in the category. Some are getting them this week. And where there's available, we're trying to get people their vaccine as soon as we can.
Tanya, do you have a follow-up?
Yes, and I'll ask that we get this one in French as well, please. Several weeks ago, you said 500 cases a day was too high a daily rate to maintain, but that's where we've stayed for quite a while now. You've clearly today been laying the groundwork for easing restrictions in the coming weeks. So are we to assume we will not see any extra or at least targeted restrictions to curb our caseload until then, despite the case count still high? So essentially, are we banking on holding the line and relying solely on the vaccine effort to do the job?
It's the vaccine effort, but it's a couple of other things as well, and it's the public health response. And we're back to the importance again and again of the case management, the contact tracing, getting on top of those outbreaks, those cases, and trying to prevent those super spreading events. So yes, I was more concerned a month ago for a couple of reasons. One, because we had not yet been able to provide vaccine to all of our long-term care homes, and we knew the tragedy that ensues if the virus gets into care homes. But also we were just starting to understand the impact and the extent of variants of concern, and their whether they would cause a dramatic takeoff, as had been shown in some of the modeling, etc. And we're not out of that woods yet, but we know a lot more about how many cases are these variants, where they're occurring, and that our public health measures to manage cases and contacts and all of the testing we're doing around people with variant cases has shown that what we're doing is working to prevent rapid takeoff and transmission so far. This is why I'm being really, really cautious, because we know more about the variants. We know what percentage we're seeing, and it's slowly going up. We haven't seen things take off, so we know a lot more than we did a month ago. But I have still concerns. It wakes me up at night worrying about. We have a lot of transmission in our communities still, and it comes in focal places. We know that most people don't transmit to anybody else, but some people can transmit to large numbers, and it is when we have people who are in situations where they can transmit to a large number of people that we see this take off, and we get these explosions in communities. And right now we're seeing it up in Prince Rupert, for example. We've seen it in communities in different parts of the province. We've seen it in workplaces, and we saw it related to the unfortunate pub trivia night. So we can't let those types of situations get us off track right now, and that's why I'm cautiously optimistic. But as we now have more vaccine, we're able to protect more people. We're targeting some of the workplaces and other places we're seeing transmission that spills into the community. The only other thing I'd say is, there's events like St. Patrick's Day, which we know can be a concerning event, and I was thinking back to St. Patrick's Day last year where we had to close down some of the entertainment districts and pubs, etc. So those are the types of things that can put us off the rails. So we still need to pay attention. But yes, I am much more optimistic that we're keeping it low and steady, and that if we continue to do that, we'll hopefully get things going down as more people are protected, and we'll prevent that from taking off. So if we do start seeing cases take off, unfortunately, then we will have to impose restrictions, and I don't want to do that. I want us to be moving towards the light.
And just to remember, Tanya had said in English that the measures that are in place now are significant measures. If you're being invited to someone else's house for dinner or an event, don't go, because we're still socializing only with those in our households, and those are significant measures compared to what we saw before COVID-19, or even we saw before November. So those measures are still in place. They continue to be in place, and this month we really have to follow them because it's an important month. As you've noted, there's significant case counts and there's hope on the horizon, but it's very important that we live in the present. And the present means that public health measures apply, the rules apply, the guidance applies, and we've got to continue to do that. There's hope in the near future, and it's real hope, and we've seen that in the results of these vaccines, but we have to continue to do our work. Je dirais en français qu'il y a véritablement trois réponses. Bien entendu, les vaccins qui marcheraient bien. Tous les vaccins au Canada qui sont disponibles au Canada marcheraient bien. Et bien entendu, notre effort, notre campagne de vaccination est très important. Deuxièmement, le travail de la santé publique ici en Colombie-Britannique, des hommes et des femmes, surtout des femmes en Colombie-Britannique, il faut le dire, pour réduire la transmission et de répondre aux éclosions quand ils existent. C'est très important. On voit bien entendu maintenant à Prince Rupert, par exemple, des difficultés et donc la nécessité d'un travail de la santé publique. Et troisièmement, tout le monde doit suivre les conseils de la santé publique et les règles de la santé publique actuellement. C'est absolument important pendant ce mois de mars. C'est pas pour longtemps, c'est pour maintenant, mais il faut vivre dans le présent pour tout le monde. Et le présent, et dans le présent, ces limitations, les règles, ces règles, des conseils existent, il faut les suivre. Merci beaucoup. Thank you very much.